My name is Lola. I'm 37 years old. I'm an accountant and a single mom to a 15-year-old son. I love any and all things travel. If you invite me somewhere, usually I try to be there. I do solo trips, group trips, anything that involves learning new cultures, new foods, new sights to see. I love it and I want to be there. On this quest, I recently took a trip to Tanzania and Nigeria, and along the way, unfortunately, it resulted in a diagnosis of pulmonary embolism, which is a condition where blood clots are in your lungs. And it usually starts from DVT, which is blood clots in your legs, and then they travel up to your lungs. But let's take it back a little bit. So before the flight, life has been really hectic. I just started a new job. I love it. But unfortunately, I did not have the PTO that I needed to take time off for the trip. So I was approved for the time before I got hired. However, it was understanding that the trip would be without pay. And since it was without pay, I worked up until the minute, basically, of my flight to go to Tanzania. So I got off at 4 p.m., got to the airport by 7 p.m., and I was on my way. It was very tiring. I was very stressed. So when I boarded that plane, I was looking forward to sleeping, and I did exactly that. Unfortunately, I didn't get up as often as I should have, and that was a result of, or the cause of, me getting pulmonary embolism. The trip had a lot of flights. So from DC, I had to go to Qatar, from Qatar to Tanzania. Then when I finished in Tanzania, I went back to Qatar, and then from Lagos, Nigeria, I went back to DC. It was a total of over 45 hours of flight time, which is a lot. I didn't realize how much it was until after the fact. I knew it was a lot of time in the air, but I didn't realize just how many hours that was. So, as I said, I was really tired and I slept. Usually I woke up when the food cart came around or to use the restroom, but I slept throughout most of the flight and I wasn't hydrated well. I remember waking up one time and I had like a cotton mouth feeling, like my mouth was really dry, and I drank some water then. But I was a little dehydrated, very tired, and just was sleeping. When I was in Tanzania, it was a big group of us women, and my friend's mom was there. And after the fact, she did, and I knew too, like I was kind of really tired on the trip. We went out on the boat, and I slept on that boat. And then at night, I was just really tired, kind of out of it. And during the trip, like usually I take a bunch of photos and videos, but this trip I didn't. I wasn't really feeling myself. I had a good time, but I just felt like I was so tired. And although I kind of anticipated the trip to be a stress reliever, I still felt kind of stressed on the trip, just tired, drained, and not me. When I got to Lagos, Nigeria on the first day, my first full day, I woke up at 5 a.m. to do my exercise, and I was jogging, and then I got like a cramp in my leg, which was, I was like, oh, well, maybe I just did too much. And I walked the rest of the way back home. And that was one of the first symptoms, I believe, was of the blood clot in my leg. And then about a week after that, I was laying down watching a movie, and I got what felt like a really, really strong Charlie horse in the same leg. And but this one, it lasted longer than a usual Charlie horse, and it was very intense. But it passed after less than 5 minutes. And I thought nothing of it. I just figured, oh, I'm dehydrated or something like that. I've had Charlie horses before at home and, here and there in my life, and I never really thought much of it. After leaving Nigeria, I got home on a Sunday. That Saturday, I felt some shortness of breath, but I also was belching a lot with it. So I just figured it was indigestion maybe. I didn't really think much of it. Sunday, I was still feeling a little under the weather, but I figured maybe I'm coming down with something, and I didn't know. On Monday, this is now 1 full week since I returned, and I was at work, and this was like my first day out because that whole week before I was working remote. And I was talking to my colleagues and kind of walking around the office, and I'm like, something doesn't feel right. And so I told my colleague, I was like, I'm really feeling really short of breath. I don't know what's going on with me. I continued working till about 12. And then I went to my manager and I told her, I was like, look, I'm feeling short of breath and I want to go to my primary care provider to see, maybe something's wrong. I'm not sure, but usually I don't, experience anything like this. So I left work early that day. Again, since I didn't have time off, I waited till about 3 to leave the office and go to my primary care provider. When I got to his office, I parked my car and I walked in the building, went up the elevator. Everything was still okay. But once I got into his office, everything took a turn for the worst. It was painful to breathe. I felt like I could not breathe. I was breathing, but it was just very difficult. And that is when I really, really knew, okay, something's not right here. He took me to the back, he examined me, he listened to my lungs, my heart, and he recommended that I go to urgent care or to the ER to get an x-ray to rule out walking pneumonia because that was going around and he thought that maybe that's what I had. So I debated on calling an ambulance or driving myself to the urgent care because I ruled out the emergency room. I was like, my copay is $300. It may be a long wait there. I don't want to deal with the emergency room. If all I need is x-ray, let me go to urgent care. They have x-rays, they have EKGs. They can let me know what's wrong and I can be on my way. So I get to urgent care, still short on breath, but better than I was at my doctor's office. They did an EKG first because I was not in good shape then. Like I was feeling, a lot of pain in my chest. And I told the nurse that. They did the EKG immediately. Then they did an x-ray of my chest. And that's when they diagnosed me with walking pneumonia. They said that's what the x-ray determined, was that it was walking pneumonia. They prescribed some inhalers, antibiotics. From then, I just treated it as if I had walking pneumonia. I didn't understand why it would be walking pneumonia. I wasn't coughing. I had no fever. Things that I knew were of pneumonia. I had none of those symptoms other than the shortness of breath. I've never had pneumonia before, and so I was, very confused, but I figured those are doctors. They know what they're talking about. And I went home and I did what they told me to do, which was rest, take the medication, and let it pass. This all happened on Monday, December 30th, and I went back to urgent care for follow-up on that Thursday. And I went back and they examined me and basically told me that, continue with the medication. I let the physician know that, I'm still having a lot of pain and difficulty breathing, especially when I laid on my left side. He said, okay, give me a second. He looks at my x-ray. He's like, well, that's where the pneumonia is. So it's understandable. Just keep going with the medication. It'll clear up in a few days. The very next day, which was Friday, January 3rd, I woke up, started working. About 30 minutes into my shift is when I experienced really bad chest pain on my left side here. It felt really bad. It was very strong and it intensified over a few minutes. And so I stopped working. I was just sitting there and I was like, what is happening to me? Like, what is going on? I know I can't be having a heart attack. Like, I don't have these kind of issues. Like, what is going on? At this point, the pain is so bad. Like, I'm crying and I wanted to call the ambulance for myself, but I couldn't even really get the words out to talk. That's how bad I was in pain. So I called my mom. She lives downstairs and she heard me. She heard the distress. She heard me crying and she came up immediately. She helped me, gather everything together and we made our way to the emergency room. By then, the pain went down a little bit, that I was able to walk, but I had to walk very slow. The tightness and the pain in my chest was something I've never felt before in my entire life. So my mom, she really likes the Suburban Hospital, so we agreed that she would take me there instead of Holy Cross, which is right down the street. But as soon as I got there, they did another EKG and they said, well, we're going to do a CT scan. And that is when they saw the blood clots in my lungs and diagnosed me with pulmonary embolism. Right when they came in to tell me I had pulmonary embolism, everything went crazy. So many people were coming in the room. It was very hectic. It was very scary. They were asking me about, DNRs, which is do not resuscitate. They were asking me would I like, counsel or like a pastor to come and see me. And I'm like, what is going on? Like, am I dying? Like, what? Like, it was terrifying. I was so scared, but they just let me know that, you're in the right place. We're going to take care of you. We're going to start you on a heparin drip and that will help stop new clots from forming. And from then you'll be on blood thinners for a few months and hopefully this will clear. But for right now, we must admit you, or they strongly recommended, basically say we're going to admit you for at least 3 days, monitor you and make sure that the clots don't get worse and that you're in good hands. So immediately when they said that, like I Googled it and then I asked them, I told them like, because when I got to the emergency room, I told them I was recently diagnosed with walking pneumonia. And they were like, well, sometimes it can look the same on an x-ray, but I was just so confused, but they started asking me more in-depth questions about my travels and any medications that I was on. And that's when everything was clicking, like, oh my goodness, like I didn't get up. I felt dehydrated. I had leg pain. And then I was like, oh my goodness, I had inserted a NuvaRing. And I'm not a regular user of birth control. However, I do use it occasionally to regulate my cycle. And I didn't want my cycle in Tanzania or in Nigeria, so I inserted the NuvaRing for the trip. And that, they believe, also could increase my chances of the blood clot. Right now, it's been about 4 weeks since I was diagnosed. I was on the heparin drip for about 30 hours. And from then, they transferred me to Eliquis, which I've been taking every day, twice a day. The chest pain has subsided. It was very strong for about 2 weeks, and it would come at any given moment. I couldn't tell you that I had to exert myself for it to come. It woke me out of my sleep one night at 4 a.m. and my son had to call the ambulance because it was so bad. I couldn't even sit up out of my bed. Like, I needed somebody to physically take me to the hospital. I went to the hospital 3 times after the diagnosis, but that time I was unable to move myself. That's how bad the pain was. I do believe the worst part is over. I haven't had any strong chest pain, I would say, for about a little over 2 weeks now, so I feel good about that. Looking back, I don't have many risk factors for pulmonary embolism. The hematologist ordered extensive blood work on me to see if I had any blood disorders. All those results came back negative. I believe the only risk factor that I had is the birth control. And we hear on the commercials all the time, risk of blood clots, risk of stroke, risk of this. And I've used the NuvaRing for many years, off and on. I used IUD, all sorts of birth control. I've never had any problems. So if anything, I don't know if that was the cause, but it could have contributed to it. Before this trip, I've been aware of blood clots for people who are traveling. I didn't know about it traveling to your lungs or to your brain or things like that. I've assumed that it would be a whole different experience as far as the leg pain. But what I was doing, before was I always got up, wore compression socks. And that was what I thought was a good, preventative measure against the blood clots. Honestly, did not think sleeping so long would have affected me in such an intense way. Now, like I said, I'll still do those same preventative measures that I used to do, such as compression socks, getting up every 2 to 3 hours. However, now I'm going to make sure that I'm getting up by setting an alarm, making sure I'm getting up, standing up for at least 20 minutes, getting my legs pumping and the circulation flowing. Also, I have to do a much better job on hydration. I drink pretty well off the flight, but in the airport, on the flight, I don't drink as much because I don't like using public restrooms. I don't know if anybody does, but I still drank, but I didn't do it in excess. But now I will be doing it in excess. I'll make sure that I'm very hydrated, getting up every few hours, and wearing compression socks. I had compression socks that went up to my knee, and I am going to be getting compression socks that go up to my groin, just for added measure of safety. This experience has affected me in many ways, emotionally, physically, mentally, even spiritually, I would say. Physically, other than the chest pain initially, and right now, like, I'm not able to do my current exercise that I'm used to. That's the biggest physical that has changed with me. But mentally and emotionally, like, I have a little bit of distrust for the medical system due to my misdiagnosis and also due to some treatment I received at the hospital. I don't believe that I should have been discharged when I was, and I was going back and forth, with the physician on duty at the time. We were having a big storm in the DC, Maryland, Virginia area, snowstorm coming in, and I feel like they rushed my discharge due to that storm. But I feel like my health should have been paramount. Honestly, don't think that I would have had as many emergency room visits after the discharge if they had let me stay on the heparin for, longer. I left the hospital at a level 46, I believe, and they told me I was supposed to be at 51, but they said the Eliquis would do the job of the heparin, but I believe I should have stayed on the heparin. So just having that little distrust, this definitely has, my faith has been tested because I honestly thought I was going to die. Many times when that chest pain hit, I thought maybe my heart was going to stop. I know the last time when it was very, very intense, I called my son's father and I was like, after him, make sure he does better. Like, I was not in a good place. I thought that was going to be there for me. The pain was just so bad that I called my dad and I was just I was really scared. I was really scared, and I thought I wasn't going to make it because that episode was just so bad. The advice that I would give other travelers is the same advice that I'm taking myself, is to get up often, drink plenty of water, and wear compression socks. I've also heard differing opinions about, medications that could help you avoid blood clots, such as aspirin and things like that. But I think those are best discussed with your doctor to see if you're a proper candidate for that. For instance, me right now, I'm on blood thinners and I can't take aspirin. So discuss with your doctor how you can avoid blood clots if you can. Something that I really hope people know is how serious PE is, pulmonary embolism is, and how fast it can affect you. And it all starts as blood clots somewhere, and those blood clots have to travel, and it can go anywhere, and it can go to your brain, go to your lungs, anywhere in your body, and cause major havoc within you, and it can kill you. It can kill you. There's plenty of people who, unlike me, where it took about 3 weeks for it to be diagnosed because I'm writing off my symptoms. There's people who didn't have that time, that the next day, the same day on a flight, they passed away. It's very, very serious, and it's not to be taken lightly. It can happen to anyone, male, female, young, old. Pulmonary embolism does not discriminate. This experience has definitely changed my perspective on travel and health. Usually when I'm traveling, I'm thinking more about where I'm going to stay, the safety of that, food illnesses, water illnesses, security, making sure that, I'm secure. But thinking about health is more than just a vaccine needed for a trip, but being properly hydrated, preparing your body mentally, not traveling stressed as I did. Of course, there's some things out of your control, but I know, I could have done a better job at planning, that I wouldn't have been, so stressed and working up to the trip, or even taking the extra day off without pay, just to rest and rejuvenate my body. Travel is a lovely experience, and everybody, I am such an advocate for travel. Like, go see the world. There's so much to see, so much to do, but making sure that your health is in good shape, as well as your security and your safety. Initially, PE affected me a lot more than it is now. As of right now, I'm kind of stable and back into my regular routine. I'm working. I'm cooking dinner for my son. I'm cleaning around the house here and there, but it is just at a slower pace. I'm very cautious right now because I'm healing. I'm still in a healing stage. It will take 3 to 6 months for the clots to fully dissolve and clear my body. So I'm, trying to walk because that helps get them out. Staying hydrated also helps with that. So I'm doing my part, but taking it easy and being gentle with myself. But this definitely has affected my family. I know everybody was so worried about me, and I'm so happy and blessed that I have such a great support system. But everybody was literally all eyes on Lola for the last few weeks, and I'm so thankful for it. But I know it took a lot out of people's schedule, their time, their money, their efforts, and I'm just so thankful. Like my son, he wasn't able to go to school some of the days because I couldn't be alone. We didn't know what was going to happen. My mom was always on call for me. My dad was making calls from Nigeria, like his doctor friends. It really affected us a lot because this was really scary. I'm normally very healthy, no health issues. I get my physicals. I take my health very seriously. I try to eat right, I exercise. So something of this magnitude to happen to me was a real eye-opener for everyone. This is all still very new to me, and I'm still doing research all the time and listening to other stories because it helps encourage me as well as teach me things that I need to be aware of. But what I want everyone to know, and to really, really, if you can do anything and take anything from this, is just know how serious pulmonary embolism is, how serious blood clots are, period, and how it can take your life away. And I don't know about you all, but I love living. I love my life. There's so much I want to see and do before I leave this earth, and I'm just so blessed and grateful to be here. And I'm happy to share my story to others and hopefully, teach you something or make you more aware, so that if you're taking a long flight, that you get up, that you hydrate, that you wear your compression socks. Talk to your doctor about ways you can avoid blood clots as well. But just please know that this is very serious. It can happen to anyone, no matter what. But I'm so happy for the opportunity to share my story, my experience with pulmonary embolism, and I hope that I'm able to reach just one person and save one person from going through what I went through, because I wouldn't wish this on anyone. But I hope everyone stays happy, healthy, and safe, and just do your best to take care of you.